Hello and welcome to the show. It's COVID-19 Watch from our Lagos studio. And then we have on the show today Barrister Ono Oyebuchuku. She's the coordinator of Children with Cancer Care Initiative, and she's also into the care for the elderly. She's going to be giving us an overview of the COVID-19 pandemic situation and how it has affected the children she relates with and the elderly ones under her care. Adam, as an individual, how has the pandemic affected you and the children you relate with, children living with cancer and the aged?
Personally, it's been an experience, good and bad. I try as much as possible to make use of this period to do a lot. A lot of people are yet to understand that we have a problem in our hands. Honestly, if you go out, even now that the lockdown has been eased a little bit, it's where people are nonchalant about this whole thing. Even to the least of wearing a face mask. We've gone back to our normal way of living, but the pandemic is still here. It hasn't gone. Government is doing their part. Of course, government cannot put on a mask on you. So all of the protocols that government has put in place, NCDs have put in place, Minister of Health has put in place and all of that, I think we need to follow them to the letters if we'll be able to fight this pandemic. Otherwise, it might still be here for a long time.
What would you say about the way the Lagos State government and by extension the federal government is handling the COVID-19 pandemic situation?
Honestly, I must give kudos to Lagos State government. They've done quite a great deal. In the area of even home isolation, that will help. Private government private partnership will be a very good way to go because we don't even have the facilities. If you have up to 100,000 patients, COVID-19 patients in Lagos, that would be huge. Lagos State government will not be able to handle it. So I think a lot of people should come in. Private people should help the government. It is a fight for all. It's not a government fight. It's not one individual fight. It's a fight that everybody, we must collaborate together. We must join our hands together to fight this pandemic that has come.
What has been your experience? We noticed that with the outbreak of the pandemic, less attention has been given to other health concerns. How have you been coping with this, considering the fact that the children you deal with are already challenged and they need attention?
These children battling with cancer were already challenged before the pandemic came. And it has to do with their immunity. Cancer fights the immunity of these children, and then they are left vulnerable. So when the pandemic came, it's like double jeopardy. So they're fighting this cancer disease, and then they have to also try to avoid getting this pandemic that will also fight the system. So what they have done is to, as much as possible, protect the children from this pandemic. So, usually they use blood. Apart from chemotherapy, they need blood, they need platelet, to help them to survive, to fight cancer. But this period with pandemic, if any of them gets down with COVID-19, honestly, it will be a very serious one. So what they're doing is, as much as possible, avoid where the infected people are. In most hospitals, of course, that the COVID-19 infected people are taken far away from where the ordinary patients are. So that has been put in place. and they are also getting a lot of vitamins because they need a lot of vitamins to be able to boost their immunity even in this period. Cancer does not know age. And when we talk about children with cancer, some people will tell you, does children suffer of cancer? Yes, they do, and quite a good number of them. That's why we have to be careful. We have to be very, very, very careful and take care of these children, you know. And also calling the government and the private sectors to find a way to establish health facilities for these children, collaborate with everyone, put their hands together and make sure that these children have some of this treatment very, very free. If it is possible, let them have free medical attention because oftentimes the parents and the guardians cannot fathom the amount of money that it takes to take care of these children that are battling with cancer. Government should open up the places and make sure that, for cancer patients, especially for the children, I was even thinking that government should also establish a blood bank solely and platelet solely for children battling with cancer, and also make sure that they have their own place, a facility that is solely for these children battling with cancer, a health facility for them.
Madam, every day we see increasing cases. Where do you see this leading us? And then the issue of stigmatization has been one big issue of concern.
I think the way we fought stigmatization in AIDS, we can also do that for COVID-19. You know, previously it's difficult for people to go to hospitals to go get their drugs for HIV/AIDS. But now it's no longer so. They even come out to say, I have AIDS. And they are being treated, and some of them are living their normal lives. We can do the same thing. I do not think that COVID-19 can also be like you have malaria, like you have cancer, like you have any disease. So I don't think it would be right for anybody to begin to think that because I'm infected with COVID-19, I should be stigmatized. I think we should all fight it. I'm not talking about, there's no statute. There's no law that says if one stigmatizes one, you mean you should go to court. I mean, there's nothing like that. But I think maybe a legislation may help because we do not know how long this COVID-19 is going to last. If it comes to that, let there be a legislation that will stop this kind of attitude between one human being and another. There are illnesses that come with old age. And aside the illnesses that come with old age, their immunity is also very, very low because there are things they used to do that they can't do. For instance, exercising is very, very good at this period. They can't do all of that. And what they eat. I also understand that some of them too, their appetite will also be low. It drops. And because it drops, there are certain things that they need to eat, like fruits and vegetables, that also boost their immunity that they don't eat. So in this regard, with COVID-19, it's extremely, extremely important for us to protect our aging men and women, our elderly people, because it's easy for them to get infected because their immunity is low, just like it is with children battling with cancer.
What is your take home to people out there who don't believe that there is COVID-19? What do you say to people out there who still go about their normal ways, saying that government is using the COVID pandemic issue to make money?
We have to begin to change our attitude towards COVID-19. People still believe government is using COVID-19 to make money. Is it possible for somebody to use a disease that is killing people, that is taking almost all our resources to make money? I do not think so. I plead with our people that we should change the way we used to live. If there are protocols put in place for us to live better, for us to manage this pandemic, I'll pray and I'll urge us, for all of us, to embrace it, put our hands together and fight this disease.
It's been nice having your COVID watch. Thanks for speaking with us.